Okay, so this is the last part of our hip extension restriction treatment protocol. So we've looked at iliopsoas restriction, we've looked at the rectus femoris, we've done our passive release technique. Now just every now and then, sometimes when you're taking people through that hip extension and you're looking at passive range of movement, you'll find that they get some thoracolumbar discomfort, or that's where they may feel it. So if that's the case, we need to locate. So there's a cluster of trigger points in and around where the thoracolumbar junction is. So if we find the very last rib, okay, draw a line up, that should bring us in line roughly around about that T12. So T12, T11, T10, even L1 and L2, a nice little cluster of trigger points lies just in that erector spinae group there. So that's what we're looking at. So simple process, as we've done before with the other release techniques here, is we're not actually looking at massaging this area, we're looking at just coming in with a broad, okay, approach again, this time not onto the spine, but just into this area here where these cluster of these trigger points are. So I always like to start superior and then just work my way inferior, okay? So I'm just going to come in here and we just drag the tissue down and in. Okay, once again, not using an elbow, but using a broad forearm, okay, and just sinking into that tissue, okay, getting your feedback from your clients, making sure that it's not too much that they can't handle. They certainly can, so it'll be tolerably uncomfortable, and we're just waiting for that tissue just once again, just dissipate, relax and melt, okay, and as we do that, then we can move on to the next one, and so on and so on. So we want to sort of roughly finish around about that L2 area. Make sure that we focus on getting that long strip of the erector spinae cluster of trigger points and just freeing that up. So keep in mind, T12, obviously, and as we look at L1 and L2 down there, that's obviously where that psoas attachment is as well. So there's definitely that relationship there. So we're just covering both bases. Simple process, dissipate, then move on to the next one. Okay?